I have something that I would like to talk about a little bit today. And that something is benzodiazepines, also known as benzos. These medications include things such as diazepam, lorazepam, Valium, Klonopin, Ativan, Xanax, and they're basically sedatives. A lot of people get prescribed them for anxiety disorders, but what a lot of psychiatrists apparently don't seem to be telling their patients is that these drugs are not for long-term use, except for intermittently, like for when you're actually having a body-numbing panic attack or a seizure. The benzos are really good for that, for a one-off thing once in a while. But when you're getting up and you're taking it every day, twice a day, it's not good for your brain. What ends up happening is you get memory loss, you lose functions in your prefrontal cortex that has to do with impulse control, emotions, mood, all that feeling type stuff. On top of that, as we well know, any drug that makes you feel really good in the moment is going to have a big pay. You have to give it a lot in order to feel that good. So afterwards, you'll be feeling like shit unless you take more. And what ends up happening is people somehow get, a prescription for this stuff and their doctors just keep writing it. And I'm just looking around like, how are you still on this pill like 12 years later? It's not for long-term use. If you look it up, if you fucking Google it, if you Google benzos, they're not for long-term use. They have been found directly related to Alzheimer's and dementia. So realistically, you're turning your brain into Swiss cheese. And just with any other pill, opiates, even blood pressure medication can cause brain damage and difference of body functions just because it's rewiring chemicals and hormones in your brain and body. But this one keeps standing out to me because I keep happening to watch people kind of like focus more on the opiates and everything, while I am watching people that I know, walk around with their eyes like always half open, sometimes going in two separate directions. One thing I really noticed, like I said, impulse control. You don't think the stuff you're doing is like inappropriate. You're just doing it. You're just like impulsively doing whatever you want. You're just getting what you want in the moment, not really caring about anything else. No inhibitions. You're high. You're basically high. Even if you only take a little bit, the smallest dose, you're still getting high off of it because your body wasn't already making that much chemicals pour out into yourself. You needed the pill to do that. My issue specifically with these benzos is that they're so easily prescribed. I know so many people on them who've been on them since they were like a teenager or younger. And for some people, it's their only option for panic attacks, anxiety attacks, and epilepsy, and I am not trying to take that away. I have seen somebody having a seizure and Ativan, intravenous Ativan, pull them out of it. Not pull them out of the seizure, but, stop them from violently shaking. It was so scary. I've never been around anything like that before. Anyways, so I'm not denying that it has its places where it can help, just like opiates, just like blood pressure medication, but just like in our world of doing way too many medications, benzos have just kind of been standing out to me for the longest time. I remember I had friends who would like snort the Xanax or snort the Valium or snort the Klonopin. And I'm like, why are you snorting that? It doesn't even like kick in like that. It takes a while. Like, you're tricking your brain into thinking you're high before you're actually high, before your liver metabolized anything. So, this is not like a PSA. I'm not telling anybody. Actually, that's not true. I am making this because I feel like I am telling people stuff. Excuse me. I am telling people stuff that they don't know, because whenever I say this, I usually am met with surprise, disbelief, Why would my doctor do that to me? Why wouldn't my doctor tell me about that? Well, because money. They want your money. And if you have insurance, they want your insurance money.